Welcome back. Now, more and more growing evidence is coming out in different reports, not from the ministry, mind you, but people who we speak to on the ground who are talking about a new variant really being the key reason behind the surge that we are seeing in cases across the country. Is that the case? Is India prepared for that sort of level of genome sequencing is what we will talk over the next few minutes. Let's get in Professor Babu on that first. Professor Babu, India at the moment, just to make our viewers understand that, is sequencing only 0.1% of the total positive cases in the country. That by any standard is not enough. What exactly is the requirement right now?
Yeah, thanks Sunil for having me on this show. The government has announced that at least 5% of the samples should be sequenced. I mean, that's the stated policy of the government. I think towards that there is a greater scope, but more than just the numbers, what we need to understand is the matching of these genomic sequencing results with the clusters. So that is the most important because if there is a new cluster happening and then the genomic sequencing occurs, then we need to establish whether it is because of the new variant of concern or not. In order to do that, two tests we need to do. One, in vitro testing to see whether this strain is far more infectious than the earlier ones. Two is establish in the contact tracing whether there is more infection among the primary and secondary contacts compared to the earlier strain. In the absence of these two additional investigations, it's very difficult to say whether it is more infectious or not. We will simply end up identifying a strain which is not really of great value later. So what we need to do is use these results for interrupting the transmission right now and to prevent the spread from one area to another.
Okay. So, Professor, at what level are these tests done to understand that? Are the 10 institutes which are doing genome sequencing across the country, are they to do it or are they to happen at state levels?
The 10 labs which are doing, they are the ones who should have additional facilities. But as far as I know, I'm not a lab person, but as far as I know, they too do not have the resources and the bandwidth right now in terms of conducting additional in vitro testing. So far more resources will have to be allocated just to do something like in vitro testing of infectiousness. In addition, to do contact tracing and establish whether the newer strains are a result of that, for that we need a lot of workforce who will do contact tracing. Currently, health workers are busy in terms of doing testing and vaccination. They can't be again given the responsibility of doing contact tracing. So this combination of epidemiological investigations with the clusters investigated for genomic sequencing and understanding in vitro testing, all of them are required concurrently, Sona.
Okay, very important points over there. I really hope the government is listening to all of this right now. Let me also bring in Dr. Avinash at this point. Dr. Avinash, when I spoke with Joe and he's worked extensively in Nagpur, his analysis seems to be that a lot more younger people are now contracting this new strain of the virus that seems to be the key behind the spike in Maharashtra at least. Is that something that you are noticing in your hospitals and in your patients as well in Bombay, for example?
You're right. When this second wave began in the mid of February, it was well observed that usually the cases which we have been diagnosing were the age group of 20 years to 45 years. It continued till the first week of March, but now after that, what we are observing that as the number of cases are increasing, the senior citizens, the patients above the age of 60, as well as those with comorbid conditions are also increasing. Even the children are also getting infected, and this is quite expected because all these 20 to 45 years old people, they are the earning people and they were going out. These were the people who were going out, they were mixing in the crowd.
When you say children, you mean what age bracket exactly?
Yeah. Recently, it has been observed that the children below 10 years are also getting infected.
Oh, really?
Even there is a report from Bangalore that the number of cases in children below 10 years is increasing like anything. They are diagnosed around more than 472 cases. And so it has been increasing even in Maharashtra, in Mumbai, in Pune, all over the number of children, the cases right now the
And when it
the
comes to
schools are
children, there is
closed.
no vaccine either here. So the only way of protecting them is sort of vaccinating our middle order.
No, the problem is the schools are closed, the children are at home, they are working, but the age group which is going out for their earning, they come out with the infections. And these children get infected by that way. And many of the children are, they have some congenital disorders or some comorbid conditions also. And because of that, they become serious. So the main point is that because of the less contact tracing right now, the 90% of the cases which we are observing are mostly asymptomatic or mildly symptomatic. So it's very difficult to diagnose them because most of the time, even they know that I have been in contact with somebody who has turned positive. They do not come forward and do contact tracing. Neither the government also comes forward. So these people become sort of carrier and they keep on spreading the infection outside also and at their homes also.
So lots of headlines coming out of this discussion really. It's been a very productive show that way. We really need in vitro testing right now to understand what exactly is the capacity of this virus. That's number one. This virus at the moment is spreading to younger people more in the country. That's number two. They are then spreading it to even children, which is a major cause of concern. And number four, really, we need to amp up our genome sequencing and just open vaccination for all, because that seems to be the only way forward. We leave it there, gentlemen. Thank you so much for joining us with the very latest. That's it on the Coronavirus Show today. We'll catch you again later. Bye-bye.